Hi everybody! We're doing an exciting facial resurfacing today with a carbon dioxide laser. It's a luminous, very high-powered laser, so carbon dioxide laser is great for laser resurfacing of skin acne marks and pigmentation. So far, she's had a numbing cream on for the past 45 minutes. Then we're going to get started with the laser. We're doing this motion, you guys, as a theory called gate theory of pain. So the CO2 laser works by making tiny little microchannels, and what's going to happen over the next 6 months. This is the result. Just keeps getting better and better. So that's this whole area is going to build the superficial active effects. This is going to be the resurfacing. There's going to get rid of all those fine lines. It was fine with the wrinkles. So that's it for our carbon dioxide laser, you guys. We did a total combination resurfacing for our patient here while she's awake. She's going to have an amazing result, 7 to 10 days downtime. But her skin is going to be so youthful, so tight, and much improved compared to where she started. Let's see how she looks in 3 months after 5 sessions. Salicylic acid belongs to the beta-hydroxy acid family of acids. Great for zapping oil on the skin. When used as a peel, this type of acid is good for those who have pimples and acne. Because of its beneficial effects, salicylic acid is often used by dermatologists to treat skin concerns like acne, melasma, freckles, sunspots. Let's see how to do it.
Salicylic acid is an over-the-counter medication that gives marvelous results for pigmentation and superficial scars. It is a keratolinic. It encourages cell turnover and helps to exfoliate the skin. Salicylic acid does superficial peeling of the skin. Start with 20% and moving up slowly to 30%. You can apply salicylic acid twice weekly. If you feel dry or irritation, you can add some moisturizers. It will soothe you. Let's see how to apply 30% salicylic acid. Start from right side of the forehead to the left side of the forehead, left cheek, chins, finally right cheek. You can apply 2 times if you are not uncomfortable. Avoid touching sensitive areas around eyes and lips, also areas already having red inflamed pimples. Upon evaporation of acid pseudofrost formed in skin, left it for 5 minutes. It can be removed from the skin with a face wash or wet cloth. For edema, redness irritation, gently touch with ice packs. It will reduce in few hours, skin peels in 2 days, leaving regeneration of new skin. For swelling and mild discomfort, ice pack can be used following the application of white petroleum for the next 3 days. Can switch to emollients as routine after the first 3 days. Please remember to wear sunscreen. It will avoid sun damage and skin redness.
TCA peels are cosmetic treatments that use trichloroacetic acid, TCA, to improve your skin's appearance. A TCA peel is a non-invasive skin treatment used to treat skin discolorations, scarring, and wrinkles. These peels get their name from trichloroacetic acid, TCA, which is used to clear away dead skin cells to reveal the newer and smoother skin layers below. Let's see how to do it.
Start from right side of the forehead to the left side of the forehead, left cheek, chins, finally right cheek. You can apply 2 times if you are not uncomfortable. Avoid touching sensitive areas around eyes and lips, also areas already having red inflamed pimples. Upon evaporation of acid pseudofrost formed in skin, left it for 5 minutes. It can be removed from the skin with a face wash or wet cloth. For edema, redness irritation, gently touch with ice packs. It will reduce in few hours, skin peels in 2 days, leaving regeneration of new skin. For swelling and mild discomfort, ice pack can be used following the application of white petroleum for the next 3 days. Can switch to emollients as routine after the first 3 days. Please remember to wear sunscreen. It will avoid sun damage and skin redness.
Ordinary peeling solution, 30 ml, AHA 30% and BHA 2%. AHA, or alpha-hydroxyl acids, are acid like glycolic acid and lactic acid, which really work to dissolve the dead skins off of the face. In addition, tyrosinase enzyme also inhibited to a less degree, which ultimately responsible for melanin formation and skin pigmentation. In addition, this also has BHA or salicylic acid. Salicylic acid is another exfoliating ingredient. It goes deep into the pores and pushes out any excess sebum or oil production, making it the perfect ingredient for someone with more acne-prone or oily skin. This can be used for acne scars and pigmentation, reduce post-inflammatory skin pigmentations and dark spots. This is formulated with 30% ash and is powerful stuff, and you don't want to misuse before you ever put this on your face. You want to do a patch test if you are more prone to allergies. Chemical exfoliators can burn. They can cause pigmentation and irritation redness. You can use the dropper to apply this acid directly to the skin. You can drop this onto fingertips and then swipe it on, or you can drop this onto a cotton pad and apply it to the skin. It's better always start with the more resilient areas of the face first. Cheeks, chin and jaw, then move over to the hairline and sides at the head, as well as the forehead. Do the top of the nose and the delicate skin that's close to the eye area with cautious. This product should never be put in the eyes, or in, and this delicate under eye area if you're worried about messing up. You should put Vaseline around the eyes and the lips to protect them. Leave this on for 10 minutes and then rinse off, and do not leave it on any longer. For most, this doesn't even burn and barely feel it on the skin, but for others, it might have a warm or slightly tingling sensation. After you finish rinsing with cold water, with acid neutralizer or a pH-balanced cleanser, if there are any chemical acid pieces left over, these could balance them out and make sure that they are no longer active on your face. If you get redness irritation, gently touch with ice packs. It will reduce in a few hours. You can go in with a moisturizer to hydrate the skin. Better to avoid using comedogenic agents, retinols, salicylic acid for the next 5 to 7 days. It is mandatory that you use a sunscreen. We've removed the outer layer of our skin, the stratum corneum. The sun could do a lot more damage than it normally does, so you need to wear a sunscreen with good SPF protection.